Give that another second to prepare. Okay, so that's happening. And let's start recording and I'll start the meeting. All right, thank you for your patience. Good afternoon, everybody, and welcome to the Nevada County COVID Business Task Force meeting. This meeting is being recorded and it's also being broadcast live on YouTube. My name is Caleb Dardick, Project Administrator in the County CEO's office, and I'm pleased to start the meeting with welcome remarks from our chair, Supervisor Miller, and Supervisor Schofield.
Well, this is going to be an interesting meeting, especially since the governor's announcement and then the fact that my head's going to explode. Brian, my head's going to explode. And then the possibility of us going back to the purple tier after a couple of days in the red. It seems like just a couple of days in the red. So, I would have rather had the governor freeze us in the tier where we were until June 15th when he opens everything up. But apparently that's not going to happen. He didn't call me, Ed. He just didn't call me. And so I wasn't able to give him my 2 cents and my advice, but that's the way it goes. I did have a call from Hardy today, expressing frustration with Western Nevada County through his constituents in Eastern Nevada County. I told him, Hardy, we're one county. Sorry, East County does not get to secede from the county. So that's a frustrating thing for East County. But it's also saying that he's got about a week and a half wait for appointments, which Ryan, Allison, I think might be contacting you about that, because I thought the appointments were a lot quicker than that over here. But he's dealing with trying to figure that one out also. So, it's this is the business task force. so let's talk business, huh? Ed, talk business. After you unmute yourself, of course.
Oh, I agree with you, Dan. I think this is going to be an interesting meeting. So I'd say let's get on with it.
Yeah. All right. Well, the bearer of probably good news and bad news from between what we're hearing about tiers and the governor's messages for later on this summer, I think is, it's both short-term pain and long-term hope, right, Ryan?
I would agree with that, and thank you for having me. I'm Ryan Grover, the county's Health and Human Services Director, and you can add me to the list of people whose heads are about to explode, because this is the last thing any of us want, is to move backwards and to have more cases. As of yesterday, we have 4,361 cases through this pandemic. 111 of them are active, and my understanding is we'll be adding around 9 to the dashboard today. Yesterday, unfortunately, we added another death to the dashboard, which was the first time in quite some time that has occurred. So we've been lucky to have seen that stabilize, but tragically, there was another death that we had to record yesterday. We're down to 2 active hospitalizations, which is something that has been trending in the right direction. And I think that hopefully that's consistent with what we're seeing in the cases, which is that more and more of the cases are trending towards younger age groups. So we're really starting to see that in the 65 plus population, the population that's most impacted by severe consequences of COVID, that the vaccines are starting to have an impact. They've been around 20% of the cases throughout the pandemic, and we're only 5% of the cases over the last couple of weeks. So that's great, and that's one of the reasons that we've opened up vaccine eligibility even beyond what the state has done at the Whispering Pines Clinic to try to get those vaccines to where the cases are really occurring. In terms of geographicily, as was alluded to by the supervisors, Western Nevada County is where most of the cases are happening. You'll recall back to these meetings a year ago now, where it was predominantly Eastern County, and there was a lot of conversation about cutting off the eastern portion of the county. So the tables have certainly turned on that in a way that's definitely unfortunate for Western County. So some breaking news to share with you today. we have our first confirmed variant. And so a press release came out from the county earlier. I'm sure we'll be seeing that in media shortly. It's the B1429 variant, which is one of the West Coast variants, colloquially known as the California variants. It's listed as a variant of concern by the Centers for Disease Control, which means it's more transmissible, in this case by around 20%, and it appears to be resistant to some treatments. So something I want to point out when it comes to the variants is that the way they detect those is through genetic sequencing, and it's something that's very rarely done. It's something that's done asymmetrically across the states. Some labs do it more than others. We actually had to manually request this sample be tested. And the reason we did that was because it was an individual who had already had COVID, who then had COVID again and was quite ill both times. And so we requested it to be sequenced in February, and we just now got the results yesterday. So genetic sequencing is not only rare, but it takes quite a long time. And so it's entirely possible, in fact, it's probable that there are quite a few vaccines already in play in the county, as there are across the state and the nation. The good news is the vaccines appear to be effective against all the known variants. And this reinfection really highlights and underscores the fact that even people who have had COVID should go out and get vaccinated when there are appointments available to you. It appears that the antibody protection that comes from the vaccines is quite a bit stronger than what you get from having had COVID. So we really encourage everyone to go out and get a vaccine if you're eligible, which now is basically everybody over 16. So rather than pause, I think I'll just barrel through and talk about the tiers a little bit, and then we can do questions afterwards. So unfortunately, this week brought the really bad news that with regards to the blueprint for a safer economy, our numbers this week hit the criteria for the purple tier. So after 18 weeks in purple, we were successful in moving to red, I believe 2 weeks ago. And then this week, our case rate ticked up to where we are now hitting criteria for purple. If that continues, and if we hit the purple criteria again next week, that would prompt us potentially moving backwards through the tiered framework. It's a little bit different when going backwards. So the state does have sort of an emergency brake. There's a process whereby they manually review our data for objective signs of improvement. They could elect, based on if they're seeing signs of improvement in our cases, to keep us in the red tier. I wouldn't hang a whole lot on that. We've never actually been in this position, so I'm not sure exactly how that works or how that will play out. But in theory, the state will be reviewing our data, and it's not necessarily 100% that we would move backwards if we hit purple next week. So I will point out that we have among the worst data in the state, and I think it remains to see if we're a canary in the coal mine that's going to undermine the state's plans, if we're going to see other counties start to trend in this direction, or if we're an outlier for some reason, and we're going to lag behind the rest of the state. In terms of our cases, the theme really continues to be sort of lack of adherence, people letting their guard down, people gathering, people getting it from the community, from being out and about. And so we really need to double down on that safety if we hope to not be left behind. So some really positive news, I think, is that yesterday the governor announced that the state will be lifting the stay-at-home order on June 15th, depending on some key metrics being met, and those metrics are yet to be determined. They indicated they would work with local public health departments, as they do have throughout this pandemic, on what those metrics should be. So the lifting of the blueprint is somewhat dissonant when we're seeing a rise in cases locally, but I'm hopeful that with continued vaccinations, and if we can just muster the strength to continue to have adherence to masks and social distancing and refraining from gatherings, that we can be in a much better place when that occurs. We've got quite a bit of lead time, and we know what it takes to contain our cases. So a little bit about vaccines. So this week we mark a milestone in having 50,000 doses having been administered to Nevada County residents. So that's a huge accomplishment for our public health team and for our providers, the hospitals, the clinics, and the various vaccine partners. These are 2-dose vaccines, and around 40% of our population over the age of 18 is at least partially vaccinated now. So that's tremendous progress, and we're already, as I mentioned, seeing the impact in where cases are occurring. Last week, we were able to move ahead of the state and opened up vaccine appointments to everyone 16 and over at our Whispering Pines clinic. That's something that will occur statewide and at all the local vaccinators on April 15th. And I want to encourage anybody who's eligible to go out there and get those appointments. We post appointments on Fridays at noon. So if you haven't been vaccinated, go to myturn.ca.gov to schedule your appointments at Friday at noon. Just having signed up for MyTurn doesn't get you an appointment. You have to go back out and schedule an appointment when they're available in the system. And then we also at our main coronavirus website have a listing of our providers under the heading of Get Vaccinated that has links to all the mechanisms to get vaccinated at the various providers that are working in the community. So I just want to continue to hammer home. We need as many people to get vaccines as possible to really realize the end of this pandemic. So I think that's where I'll end.
Well, thank you, Ryan. I just want to remind our attendees that you can put questions in the chat or in the Q&A and we'll get to them. But first, Supervisor Miller.
Hey, Ryan, I talked with Hardy Bullock today, and Hardy was saying that and I think Allison might have talked to you, that they're out about a week and a half in appointments in the Truckee area. Is that a normal, or is that longer than normal?
So, I mean, we schedule vaccines for the following week on Fridays. So scheduling them a week out is normal. I'm not sure exactly what Tahoe Forest practice is. I believe they're supplied with vaccine at the moment. And so it's not an issue of them not having vaccine allocated. They receive from both Nevada County and Placer County. But I will check in with them because it does seem like that's pretty far out.
Yeah, he was concerned. And so since we've got this going on today, I thought I'd just throw that out to you.
Sure, I'll circle back.
Thank
All right,
you.
and got a question, Ryan, or really a comment from Wendy. Wanted to share that I'm aware that we in Nevada County have a fully vaccinated person test positively recently. Are you aware of that?
I'm not aware of that. It's certainly the case that the vaccines are not 100% effective. I believe the metrics that were shared for Pfizer and Moderna were in the neighborhood of 95% effective and somewhat lower than that for Johnson & Johnson. Typically, when people do get infected, despite having the vaccines, they're a less severe case, sometimes asymptomatic. So that's still a clear benefit of getting vaccinated, and that the possibility that people can still get the virus when they're vaccinated is what kind of underscores the caution that public health officials have been advising in terms of continue to wear masks, continue to practice safety, because yes, you can still get the virus and potentially transmit it to others, even if you might not end up in the hospital as a result of it.
All right, thank you. Any other questions for Ryan from the panel or from our attendees? Okay, seeing none, thank you. Thank you, Ryan. We'll go to the next agenda item, which is a business resources update from the Sierra Business Council. We have Kristen York and Leslie Williams. And it looks like Leslie is eager to share her screen. So we'll start with Kristen and let you guys take it from there.
Thanks, Caleb. Yeah, Leslie eagerly went through the pre-application part of the shuttered venue, which we'll get to in a minute, and she's there's still steam coming out of her ears. So we'll talk about that in a second. I'm just going to touch on the highlights so I don't sound like a broken record. But as a reminder, the PPP Paycheck Protection Program second draw was extended until June 30, 2021. If you've already received one and it's been forgiven, you may be eligible for a second draw. If you've never done it, you are definitely eligible. You just have to document that 25% reduction in gross revenues. I have it on the inside information. There are certain businesses I know that are doing very well this year, and we're still able to prove that 25% reduction because it's only for one quarter. So if you took your hit in that first 3 months, like the second quarter, April to June, that's what a couple businesses have done because there was some uncertainty. And then they kicked it up in the second part of the year. That does not take you out of the running. It's not annual revenues. It's only for a quarter. So check that out. On the EIDL, I want to point out there was a union article and there was some incorrect information in there. It said that you would not be eligible for the EIDL if you had other grants or I believe it was related to the RRF. That's incorrect. The EIDL is separate. The EIDL is a disaster declaration by the federal government, which makes you eligible, our entire region eligible for a loan, economic injury disaster loan. So that doesn't, the EIDL is not impacted by any of these other programs. And that deadline is the end of 2021. So remember, that's a loan if you need it for working capital. Now, this shuttered venue operators grant opens tomorrow. I might just let Leslie take the horn because she has spent a lot of time on this. She had an update today by our national leader. So Leslie, why don't you jump in and talk about this very confusing, but
thank you.
grant.
Yeah, this is
Yeah.
the slide I meant to share. Sorry, Caleb. Sorry, everybody, for that interruption. So the Shuttered Venue Operators Grant is administered by the Small Business Administration. So everybody that wants to apply for that, this would be the performing arts, the movie theaters, all the event centers. Finally, there's money available. They have to register at sam.gov in order to apply through grants.gov. And every applicant has to have a DUNS number. So some small businesses, that's Dun & Bradstreet, might know that they have a DUNS number. That's not required, but that's typically how small businesses have business credit. That's what lenders look at, is their DUNS number, and they can get like a credit report essentially. So there might be a lot of venues that don't even know what this means. So it is a little confusing. So you start the application by registering with SAM, and then you have to have a DUNS. So then you have to register with DUNS. That takes about 2 days. The SAM registration, I just heard, takes about 12 business days. This is a first come, first serve relative to the size of the venue. So I think it's going to be super confusing out there. There's a lot of room for error on the application, it looks like. If the business name is input on the application and it's different than the DUNS name, or if the address is different than the United States Post Office address, you know, where you put drive, DR, or street, ST, or STR, EET, those little tiny errors are going to create havoc on this application. I hate to be negative because we've been waiting so long for this to come out and be available, but talk about a head exploding. The information today was excellent. The information was just fabulous, but it was disconcerting because nobody really knows why the government is making the applicants register through SAM, because all they're going after is this one grant. So typically you would have a SAM account if you were contracting with the government or going after all kinds of grants with the government. So there might be some nonprofits out there that are already registered, know all about this. None of this information is going to be foreign to them at all. Good for you, go for it. So basically, this is the key slide, which has all of the web links. And if you have any event center or any applicant that you're aware of that needs help, you can direct them to us, info@sierrasbdc.com. But I'm just going to have to redirect. And the really awful part about this is the sit and wait with the SAM registration. So there's a lot of emails back and forth, and then you have to do a certification letter that has to be notarized within 60 days after you're activated by SAM. So it's super intense just to trying to get access to this money they're talking about. So there's 60 million. They're talking about the average grant of about being $1 million, which means like there's not going to be that many that are awarded, period. This is across the whole country. So we know everybody's been clamoring to get at these funds, and it opens tomorrow. So I'm sure the funds will be ringing off the hook, and please feel free to direct everybody to us. We'll do the best we can to help, but we can't get inside any of these systems. That's the hard part. All the applicants think that we can get into the SAM system and check on their registration, or we can get to DUNS. The big thing is to make sure you tell everybody, don't pay for a SAM registration. There are scammers out there that are charging $600 to get that SAM registration and or to do the SVOG application for the applicant. And sometimes the scammers will put their bank account in the application instead of the applicant's bank account. That's how scammers fraud the system and get the government money. So make sure it's the right email address. It's got to be sam.gov or the DLA.mil. Any other website is not for real.
Thanks, Leslie. That was awesome. I got to experience her head actually exploding when she was going through the SAM site and realizing all this. So, and Wendy has a question. It's a great question, Wendy. Is the grant eligibility for those with venues only? Yes. She says, I'm thinking of organizations that produce entertainment but don't have their own venue. So we did sort of find a loophole with that where the producer or the entertainer can actually issue an invoice to help prove that that venue's grant amount. So I'm not.
Let me share that because the promoters.
Yeah.
Those that are the independent contractors, they're the ones that are really, really having trouble because they don't have a venue. It has to be a venue. So anybody that supports the venues as an independent contractor, if the venue is awarded the SVOG, they can use an eligible use of those proceeds is to pay an independent contractor up to $100,000. So for all your promoters or your independent contractors, you might want to share with them that they want to talk to their venue people and say, hey, you can pay me. It's an eligible use of the proceeds through this grant. So depending on how much money the venue gets, it's going to be their decision whether or not they're going to dole it out to an independent contractor or promoter. But the definition of promoter, tons of small businesses meet the definition, but they don't have a venue. So they're nixed out of this program.
Yeah, a couple other things. It would be available. It can be available to the fairgrounds. I mean, what Leslie and I are saying is, when in doubt, apply and let them kick you out. But early on, there was this whole provision for you must have fixed seating. That has changed. Fixed seating only applies now to museums and movie theaters. So, which makes it like, I think immediately of our theaters down in Western Nevada County. Most of them don't have fixed seating. So they would be eligible now. Which also the fairgrounds, if they have an auditorium with flexible seating, yes, I would apply. I would apply and characterize it as, make sure you use the language in the grant. The other thing is, it's okay to have the PPP. It will just, if you got it after December 27th, it will be deducted from your amount. If you happen to get the shuttered venue, you then can no longer apply for a PPP. So lots of shifting. We have 27 pages of guidelines that just came out with some shifts.
Wow.
So also the other thing it's important to note is that there's a priority rollout. So the first priority will be for venues that can prove a 90% impact on their gross receipts between April and December of 2020. And then it every 2 weeks it ratchets down.
Kristen, we got a question in the Q&A from Cassie. What if the venue is on public property, i.e. Truckee Thursdays?
Cassie, that's I think a no-go because it's not a fixed venue. Public entities are sort of like, even a auditorium in a public school is not eligible for this. Yeah, you can't temporary venues are not eligible. It has to be a fixed venue. If you're a traveling circus, though, you are eligible. Just so you know.
How does that work?
I don't make the rules, man.
We'll all become traveling circuses.
The traveling circus lobby is alive and well. Yeah.
Good. Well, any other opportunities out there? What do you tell small? Oh, Gretchen has a question too. Do grants received count as revenue or contributions?
These are not initially all this money in CARES was identified as taxable. The new ARP is saying any of the grants are not taxable. So in that case, it would be if you're a nonprofit, then it's not taxable. I would put it as revenue. It's not a donor contribution, but yeah, I'm thinking it from a tax perspective, but for a nonprofit, That we have to get back to you. Not a tax expert for sure. Yeah, Amber, you should let them know they need to prepare a spreadsheet of at least 4 shows per month with link to the show posters. This is part of the application. It's a lot. It's a lot. Therein lies why Leslie's head was exploding. And I thought there was I know. There was 2 other things I wanted to tell you. One is that the last round, shifting gears, of the California Relief Grant opens on April 28th. That's the 6th round. So last round, they're going to give all the money away. So if you're still in the queue, you're still in the queue. If you've not applied, you'll definitely want to apply for that last round. And then Restaurant Relief Fund, we have no new information on that. It took so long to get this shuttered venue operators grant out that I imagine we've got some time before RRF comes out.
It looks like Amber Jo has applied. Amber,
You can't,
you haven't? Oh, I see. You're just preparing for it.
it's not open till tomorrow.
Okay.
Basically, they want to make sure there's no fraudulent venues coming through.
All right. Any other questions for Kristen and Leslie? Any from the panel?
Patrick at Fair says state SBA says no to fairs. Okay. What about the, can you identify, like, I know David Attaway was looking at sort of extracting his venue, his, with the fixed seating, state, yeah, I mean, I would still put it in, honestly.
Questions in the Q&A. Marnie, do people trust in being in queue for the Care Relief Grant? Advice was given that people should reapply if they haven't heard.
They'll kick you out. They will, it's not even worth your time. But Amber has some really important information here, which I believe. So they have a checklist prepared, all the items in a folder. Many organizations believe the money will run out and are planning on applying immediately starting in the morning. Wish us luck. Yeah, even if you're not in that first priority, it is first come, first serve. I would just get it in.
Cassie asked, do we need to resubmit for round 6? Sounds like you just answered that no.
No.
Well, I have to just interject. If it's a nonprofit and they applied in round 4 and haven't heard at all or haven't been notified at all, then yes, they should apply in round 6 if they didn't reapply in round 5, because round 4 was a carve out specifically for performing arts and nonprofits, and the parameters were a little different. They were up to like 10 million or something like that in revenues. And so
Yeah.
the other California Relief Grant that allows nonprofits is only 2.5 million in revenues. So I'm not sure where Cassie's falling, if she hasn't heard about round 4 yet, or if she's already applied and has been waitlisted. There's a difference there.
Cassie, I'm going to allow you to talk. Why don't you let us know what you're going through?
Can you hear me?
Yes.
Yeah. So we applied in round 1, so we're still in that queue. So I'm assuming this is being pushed. We weren't
Okay,
eligible.
yeah, don't reapply.
Yeah.
Yeah, do not reapply.
Right. Thanks, Caleb. Thank you, Leslie.
Great. Hey, Amber Jo, I'm going to bring you on
Hi.
to
We're all in a meeting. How are you?
Hi, good. I'm just dropping off these files.
Leslie. You might want to go on mute.
Sorry.
So
Amber Jo, you want to share how you're preparing for the grant? Kristen, control your team. My goodness. All right. Looks like Amber can't hear me. All right.
What's happening here?
Oh, I see. Oh, Amber will join, but she's going to use her telephone. All right. Give her a minute. Anything else that businesses can be thinking about, sort of perhaps even looking past this current tier system to mid-June, what the future looks like?
Yeah, well, I've already heard from a number of businesses that, with respect to going back to purple, that literally this was the quote, it's going to be impossible to put the genie back in the bottle. And I'm looking at Ryan, like it's going to be, it's going to be difficult. It's, the weather's good, people are out there, and it's going to be rough. And so brace for that. If the other thing is just on the technical assistance side, there's a business igniter starting up at Sierra Commons, and then we have a business creator actually, and that'll be out of Rockland. But there, if you want information on any of those, we will have it on our website.
Okay, Amber says you're here on the phone. Go ahead then. I see there's a second Amber. Got it. All right, that should work now.
Oh, it works. Sorry. I lost my sound in my computer halfway through the pandemic, and we haven't had the money to buy a new computer, so I'm on the phone. I've done a ton of the SVOG workshops. I've probably done all of them in the country. So I'll tell you this, go through that checklist, get everything in a Dropbox, be at your kitchen table with every single item prepared and ready. You have to have at least 4 events per month. So be ready for that. Have it pre-calculated what you're eligible for so that you understand where you are in the priority. Very important. Martin Pult, who is our CFO, as well as the CFO of the county, helped us to understand that you are able to subtract the CARES Act funding that you received emergency funding throughout the year. That shifted us all the way into another priority level. So we went from priority 4 to priority, 2. That is really going to help our position. And also, we totally don't want to be discouraging. We want to say, hey, everyone should apply. You should know that all of the universities that have theaters, they are all bailing. They're not going to apply. So you do have a chance. Cal Performances, San Luis Obispo, they are all super frustrated. The universities have forced them to furlough all of their staff. So people like us, these independent venues, we finally have a chance because, we used to complain our whole lives we didn't have the big university money. Well, now we have a chance because we weren't told to furlough all of our people. So a lot of those universities aren't applying. You do have a chance. You should give it a shot, but be ready to go first thing in the morning. So I don't know. That's just what I wanted to say. We're going to give it a shot, and I'm optimistic.
Sounds like that's really great advice and great to hear how proactive you're being, and would encourage others on the phone who might have venues to call Amber Jo at Center for the Arts.
Yeah, we're happy to answer questions. We still have our finance manager, and we have to thank the county. The only way we could apply for this funding is if the county hadn't given us that generous grant, we all wouldn't be here with our door open, right? So because we received the generous CARES Act funding, we're still here with our door open. We have people to apply. So we are happy to be a resource for anyone with questions. My HR manager and admin manager and myself have read everything. So we're happy to help.
All right, thank you so much. And it looks like, Ryan, you just answered a question that somebody had in the chat about vaccine availability, but do you want to share it with the group maybe?
Sure. Yeah. So the question was, the person was under the impression that people under 50 weren't eligible until April 15th. And that's true statewide. And it's true in most of Nevada County as well. At our Whispering Pines clinic, we actually opened up beyond that just because we're seeing so many cases occur in age groups under 50. And so in order to get appointments, if you're under 50 in Nevada County, you can go out to myturn.ca.gov on Friday at noon. That's when we post appointments out there, and you can book your appointment. I know of quite a few people who were able to do that last week. And then some of our providers also are vaccinating people who are under 50 years old. And so that information is out on mynevadacounty.com /coronavirus and going to the vaccinated or vaccination page. And there's a Get Vaccinated link, which lists all our providers and how you sign up for appointments, including who they're vaccinating. So hopefully that's helpful.
All right, we're getting Leslie. Leslie is asking Amber and everyone, I don't know if that's for the group or not. Oh, I think the question
It
to
could
you,
be.
Amber,
It
is
could be.
Amber, if you're still on the call, are you registered with SAM and already have a DUNS? How long did that take you, or did you already have it? You know, she might have gone back off because she was using her phone. All right. I think we have answered all of our questions here. Tim Corkins mentioned that we still do have pallets of hand sanitizer. So we should be thinking in the business community out there about, making it available, continuing to make that available. And then I keep hearing on the news, from when people are always asked about what to do about this next month and a half, is this push for vaccinations. I'm just wondering, for those of you in the business community or those of you in the public health side, are you seeing any role for business in sort of helping to promote the message of getting vaccinated to their customers and, as a way of reopening the state? Is business taking any leadership role here? Is there anything that you've just seen or observed, Kristen, Ryan, anybody that you're hearing about, sort of a role for the business community to help us all out?
I'll say we'll take any help we can get in that regards, and we really would embrace anybody who wants to help us with messaging about the importance of getting vaccinated. The people who, the relatively small group of people who are against the vaccines are very vocal and very loud, and so I think we need to have people speaking up for getting vaccinated, because it's truly our ticket out of this.
Okay.
Hey, Ryan,
And then
Hardy asked me a question earlier today. Do we know how many, and I don't know the answer, what is the number of those people in, say, Western Nevada County that are just totally opposed to a vaccine? Do we have any idea what type of number we're looking at?
No, I will say that Nevada County has the lowest school age vaccination rate in the state in normal times. So we have quite a few people who are just flat opposed to vaccines, and that is definitely more prevalent in Western County than Eastern County. It used to be that only 70% of our school age kids were vaccinated. That has increased since the state implemented the requirements. But I don't have a hard number. I will say that we're seeing quite a bit of just vaccine hesitancy based on this impression that these vaccines are new technology. mRNA has actually been in development and being researched for 40 years now, so it's not exactly new. And so, but I think we're seeing that sort of hesitancy taper off a little bit as more and more people have been vaccinated with very, very few complications. And so there's those two components: the people who are just outright against it, and then people who are just kind of waiting and seeing. And if you're on the fence and just waiting to see how it plays out, I would say get your vaccine as soon as possible, because they're safe and effective.
Okay, thanks.
Yeah, and for those of you who are following along in the chat, there's been a good discussion to the question about registering with SAMs and DUNS numbers, and Amber shared that it was an arduous process. It takes time, but we had it already. Gretchen from the Foundry was registered with SAM. Sheila posted the link to getting vaccinated. Gretchen said more, it took almost 2 weeks. It needs to be notarized and sent in. It can take a long time. Member said call SAM, I guess, is a phone number that gets you through quickly. Sounds like Amber Jo has a survey going out. Maybe you could tell us more about that. And then to my request to the business community to help, Cassie said Truckee Downtown Merchants Association will help. And I'm going to have Marnie Marshall follow up with you. She's working with us on business outreach and helping develop those materials with public health team as well. So Cassie should be hearing from us soon on that. And then of course, any other business leader groups, chamber groups that want to, get involved with the messaging, please reach out to me or Marnie Marshall, and we will absolutely work with you to get collateral material, messaging, et cetera, to work together. I think that could make a real difference. All right, with that, let me turn it back to our supervisors for closing remarks. Chair Miller.
No, I think the conversation on the vaccines is important, and we just got to get it out to everyone that, as Ryan says, the vaccines, they work and they're safe. And it's surprising how many people still are so hesitant about doing it. My thoughts are, if there's a chance it works, stick the needle in my arm. I'll take that chance. And but fortunately, not everybody's like me. But or unfortunately, not everybody's like me. But it's important, important for our community, and this drives me crazy that we have the possibility of going back in the purple. Just drives me absolutely up the wall. And I don't know, Ryan, if that's fewer testing, which doesn't work well for us, or if there's something else that's going on. But get vaccinated. If there's a chance that it works, then take the chance, and because otherwise we're never going to get rid of this, and it's always going to be hanging over our head. And I'd rather it not, hang over our county's head.
All right, thank you. And then before I go to Supervisor Schofield, I just want to share with you that the next meeting is May 5th, and between now and May 5th, the Board of Supervisors will be meeting twice, but they're meeting on April 27th. They will be hearing a presentation about the federal funding, the American Rescue Plan Act monies, and sort of staff's initial recommendation, and seeking direction and input from the board on how best to use that money to benefit the community. And so I would expect for our May 5th meeting, we'll be able to report back on the direction that we're going and how we can use some of those resources to benefit the community. And
Caleb, you know that 30% of that new money is still going to go back into the community, just like we did before. Yeah. So that's where 30% of it's going to be headed. So that was a commitment that we made the first time, and we're holding true to the second round also.
Yeah, thank you, and that's looking forward to getting that full direction from you and sort of some of the specifics, and then getting that information and opportunity out to the community as quickly as possible. So I just want a little bit of a tease for making sure that you put May 5th on your calendar to stay abreast of that. And with that, final remarks, Supervisor Schofield.
Well, final question for Ryan, if I may. So Ryan, if this variant was actually first reported back in February, I assume that means there's probably quite a bit of it circulating in the county right now. And does that relate to the increase in the positive cases, or do we even know?
So, yeah, given that the sample was taken in February, I would also assume that the variants are here. We know most or all of the variants of concern are in California. The variant that we detected is the quote unquote California variant. And so it's quite widespread in California. I think there are 6,000 some instances of it in the state. But as I said, that's the only sample we even know has been tested in Nevada County, and it was positive. So we don't have direct evidence that they're widespread here, but I think we can safely assume that they are here. And because those variants are more transmissible, this one, the CDC listed as 20% more transmissible, that certainly contributes to additional spread. Whether that's why we're different is really hard to say without the data, because these variants are in other places as well. So I don't, frankly, I don't know why we're unique, and I'm as frustrated with it as anyone else.
Well, I think we're all frustrated. As Kristen said, the person that said to her, it's going to be hard to put the genie back in the bottle. I think that's really true. I would hope that the governor would take a look at things and say, maybe this tier thing is not really appropriate now. When we look at Placer County, that's going back, and it's like, it's frustrating. It's frustrating. So hopefully we can do all we can to follow the the recommended standards, keep that mask on. I know even myself, I find myself relaxing quite a bit because I'm vaccinated. I've done some social things that I hadn't done prior to that. So I guess we all need to rethink it and just be very careful with what we're doing. And I appreciate all the work everybody's doing. Kristen and Leslie, thank you for your knowledge in helping our businesses. Thanks, Caleb.
All right, thank you. I want to thank our panelists, another great meeting. And just please note that in the chat, I put a link, and it was also in the agenda that I emailed out to you, a link for a newsletter that's specific to this group that we would really like your help in getting out, because even though we're meeting monthly and we had a special meeting in between last time, there is grant opportunities. They are time sensitive. We don't ever want to be the ones who delayed getting information to the business community by even a day. So this newsletter, e-newsletter, is a way that we will get economic development related news, opportunities, information, really targeted to the business community. So please encourage people to sign up for it. It's already, I think, quadrupled in subscription just since last month, but we're hoping that that will become a vehicle that we can get this information out to people who don't have time, who can't log on to a call in the middle of the afternoon because they're running a business or something else. So we want to make this information as accessible as possible, and email is one of the better ways to do it. And there's also an option to have this texted to your phone. So when people sign up, they can subscribe to this newsletter both as a text and as a email. So please encourage your constituents and members to use this. And with that, I'll thank everybody, and I'll be sending out a link to this recording once it comes through, probably in a couple hours. So, all right, have a good afternoon.
Thanks, Caleb.
Thank you.